I'm John GRAFFT, and I love Chicago real estate. Between showings, I stop in my favorite places, talk with local business owners, and bring their story to you. This is my Chicago.
What made you decide to take this space?
I mean, literally, I was just like walking by, and I saw they were building this, and it was convenient at the time when I was living in Lakeview, and then I don't know, I got to build it out.
Needed a space,
yeah, and I don't know. I guess I thought it could be an investment, you know, versus just lease space, you know. So.
I think if people know you own your space too, it's an investment in the neighborhood, and it's a commitment to the neighborhood.
Right.
You're like, I'm here to stay. This is my office.
Yeah.
And this is such a convenient for you, a convenient space for you, for other people, because people can pull up and park.
Yes.
It's very central. It's on Southport.
Right.
It's very easy to access.
Right.
And this is an interesting stretch of Southport too. It's a little sleepy.
Yeah.
And then it livens up as you go over there, and then at Clybourne, it livens up in that direction.
Right.
But right here is very residential, and you get a real neighborhood feeling.
Yeah, it is. People love the ability just to like drive up, get out, and not have to like deal with elevators or punch in codes or buzz in or buzz out. But yeah,
it's always weird when you go to someone's office and they're like, okay, and you hit a buzzer and you like buzz, and then you go through another door, and then you get into an elevator, and like, all the common spaces are kind of run down.
Yeah.
Like, okay, where am I going? Like, before you even get there, you're like, I think I made a mistake.
I have had people ask me if I lived here.
Yeah.
They're like, this is so nice. Is this your house? And I'm like, no, but
My first office was right down up the street at Southport and Diversey.
Okay.
And it was an 850 square foot, 2-bedroom, barely a living room. And it was my office, but I would always have one door closed, and I slept in that room.
Did you? Yeah.
And I had agents working for me, so I'd wake up at 6 in the morning, shower, move all the toiletries and all the things like out of the bathroom so it didn't look terrible.
Oh my gosh.
And always that room was open. If anyone ever asked, like, yeah, it's an office. So like, I was 20 years old or 21 years old running a business, and you're like, this is the only way I could do it.
Right. Yeah.
Yeah.
I mean, I think that's a good deal.
That was my first apartment on my own, first office. And it was such a strange way to do it. I remember someone was dropping earnest money off one time, another agent, and they're like, this isn't right. And they wouldn't leave it in the box I had. They're like, nope.
This isn't a real office.
Yeah. So tell me about Alaska.
I was thinking about Alaska this morning because I feel like Alaska was the coolest place to grow up. It was just so roll with the punches kind of place, you know, very outdoorsy. The reason I thought about it is because I just signed up for a camp out on the beach in Wilmette, where you get to camp on Gilson Beach overnight.
That's super cool.
Which is super cool.
Yeah.
So I was like,
kids will love that.
Heck yeah, I'm doing that.
Yeah.
Right? And I think that's something maybe that Alaska, you know, kind of inspired or instilled in me. It's just like adventure. Just do it, you know, opportunities, take them, and be adventurous.
I imagine it's in the fabric of your everyday when you're in Alaska.
Yeah.
What's a day look like?
Yeah, I mean, so growing up there, you know, the seasonal change was very cool. I didn't realize that it was unique, because that's all I knew. But having daylight hours, you know, all through the summer virtually, to be able to go outside and play or camp or fish, play golf at midnight, you know, so that was something that was really cool. And then the winter's kind of the opposite, where everyone's just like hibernating and the daylight hours are like 10 to 4.
Yeah.
So, and on a gloomy day, you just feel like you never see the sun. So, but that's all I knew. I mean, it was just a great place to grow up. You feel like you're in your own little world, essentially, there. And our family would typically travel like once a year to like Florida or Seattle or somewhere in the lower 48.
Yeah.
Yeah.
Did you ever go to Hawaii?
Yeah, we went to Hawaii a few times.
I feel like that would be natural, because they're polar opposites, but very similar in a way.
Yeah, right. And a direct flight, which is easy too. Yeah.
What is the flight? How long is it?
It's about 6 hours.
It's really 6 hours, huh?
5.5, maybe.
Okay.
6. Yeah.
As long as I would think.
Yeah.
Had your family been in Hawaii, or excuse me, been in Alaska for so long?
No, so my dad was from Ohio, and he hitchhiked from Ohio in the 70s to Alaska.
What do you mean?
He just got on the side of the road. What is it called? Like the turnpike or something like that in Ohio, and hitchhiked. He's told me stories about being with, like truck drivers or just various individuals on his way there. And he didn't have a plan. He just knew he wanted to get out of Ohio. And he went to school at University of Miami for accounting. So he's an accountant. So he took his first job like at a hotel in Alaska as like a night accountant. And then he loved it. So he went back to Ohio and got my mom, and then she moved up. So.
Wait, so he knew your mom already? And he was hitchhiking?
Yeah.
So your dad's an interesting person.
He's very interesting.
Okay.
Yeah.
But he's an accountant.
Yeah, well,
The accountant and hitchhiking aren't two words I would ever put in the same sentence.
He was very adventurous.
Okay.
Yes, very just do it and see what happens. Yeah.
Wow. Hold on, I want to know more about your dad. Tell me more about your dad.
Well, he passed away in 2020, so that's the hard part of the story. But he was a real estate developer in Alaska, and his last project that he was working on at the time of his death was Settlers Bay Golf Course. So it's the only residential golf course in Alaska. So he had originally purchased the course, and then he worked on developing the surrounding land for residences. And then part of the land he sold back to the state to develop a coastal park. So it was a really big project, and still a work in progress.
That's really
His
cool.
partners have continued to develop the land and work on improving the course. Yeah.
So he went from a night accountant.
Yeah.
And then how did he develop from there in Alaska?
It was real estate. He started working in a real estate company. He started working at a company called Jack White Real Estate, and he was the accountant there. And then, progressed to a smaller company where he was, a controller, and then kind of went off on his own to do his own developing with his partners.
That's very cool.
Yeah, it is.
When he got to Alaska, what did he like about it? What made him want to stay there?
That's a good question. I mean, I feel like my dad was always this person who just wanted to get away. So I think he liked being on his own. I think he liked that independence. And then he was also very outdoorsy. Like, he liked to camp, and he liked to fish, and he liked being, the guys outside, Yeah, so that was his jam. He really liked that. I
have a friend, Lauren Majera, she's a newscaster. She got a full ride to Alaska for gymnastics.
Oh, cool.
And then she got into their not sportscasting, but like media broadcasting program. Loved it.
Yeah.
And she's been doing that ever since. But she's there all the time. Like, she goes back every year, a couple times, it seems like, in the summer. And it just seems every photo, every video she posts is the coolest thing in the world.
Yeah.
And it's so outdoorsy. And I've been there a number of times, but I've never done anything planned and very well put together. And something where you could actually stay there and do something.
Right.
And see it for the best that it is.
Yeah, right. I think it's worth planning some, intentional trips. If it's, a once or twice in a lifetime kind of thing. Like halibut charters, or going to see Denali, and, those things are really cool to do.
When do you think you'll take your kids there? Or have they been?
We've gone every year, the exception being 2021, because 2020 we went for my dad's funeral, but other than that, we'd been every year in the summer. Yeah, so we're going to keep that up.
What do they think?
Well, my son loves to golf, so we always go to Grandpa's golf course and play there. And, my daughter, she's still kind of figuring it out. She doesn't know where she is half the time, probably, right? She's 4, so she's just along for the ride. But
well, especially if you come from here or the suburbs, wherever you're at. If you go from Illinois to Alaska, that's polarizing.
It is, and I think they enjoy the scenery. They like all the green. They've commented on all the trees before, and mountains and all of that. So, yeah, it's been it's a tradition I want to continue to keep bringing them up there.
How old's your daughter and how old's your son?
So Harrison's 7, and he's in 1st grade, and Georgina's 4, and she'll be in kindergarten in this fall. So
as you see them grow, do you see any gravitation towards outdoor elements, or like something that's innate in you that knows in your dad, that's maybe in you, that's passed on to them? Do you see that? I do. Well, Harrison's a big golfer, so I definitely see that in him. He's also a mathematician. Okay. So that takes after both my dad and then my husband and I as engineers. And then as far as my daughter, she seems very free-spirited.
I'm not sure yet.
Okay.
I don't know. She's figuring it out.
Because we're pregnant.
Yes.
Yuna's pregnant. The we're pregnant thing is always strange. It's like I'm not pregnant. She's doing all the heavy lifting.
Right.
It's kind of crazy to say.
Right.
I don't know what do you say? Like I'm pregnant. My wife's pregnant. Then it's like, well, you had something to do with that.
We're having a baby. I don't know.
Yeah, but I feel like I'm taking way too much of that load. Yeah. It's like 90% her, and I'm throwing we on it. It's like a guy who worked himself into a company. Now he's like, this is my company.
Right. Yeah. I don't know. That's hard language. I don't know how to describe it. We're pregnant.
Yeah.
Yes. Yeah.
But thinking about what your kids will be and what they're going to look like.
Yeah.
Especially since our kids are going to be like Asian, so Korean, Hawaiian, and then Polish and Irish. Like I don't know what that's going to be.
Yeah.
And we've seen so many kids that are mixed like that. You're like, some look great, some don't. And you're like, I hope they don't look like that, unfortunately.
Oh my gosh, John.
Then you think about who they're going to be as people, and
and
I don't think just we all grew up, we all changed, and we all become who we are. Like I think you can influence it, but you can't change it.
No, I don't think you can. I mean, I think that you can do your best to impart values and family traditions and things like that, but they are who they are.
Yeah. My aunt says something that I really like. She has 5 kids.
Yeah.
And she's like, I don't take credit or responsibility.
Yeah.
For what they've done. They're their own people.
I think that's a good point.
Yeah.
Yeah.
Will you send them there to like be with your mom? Like, would you ever send them to Alaska for a summer?
Yeah, I think I would.
Yeah.
I mean, it depends who ends up living there long term, because I don't know if my mom will, but it would be nice to send them there or have some sort of extended summer vacation there, other than just, a week, maybe a month in Alaska or something at some point.
Yuna and I talk about it because we're like, she has family in Korea still.
Yeah.
And then she has Hawaiian roots. We're like, let's send and we think about how we can travel. So we're like, we can go to Korea.
Yeah.
And then we can drop the kids off with the grandparents.
Yep.
And then go wherever we want in Asia from there. And that'd be a good way to escape. But then on the flip side of that, you're like, we want them to have some of their Korean heritage. So let's send them for a summer or send them for something once they're old enough. I don't know what that age is.
Yeah, I don't know. Maybe early teens.
Right?
I think so.
Middle school to high school.
Middle school to high school, right.
Something before puberty maybe.
Right.
Or like I don't know. I have no idea.
Yeah, I guess it depends on what their interests are too. You might be tied down for sports or something. You never know, right? Yeah.
And they're not going to want to
something that keeps you here.
I would imagine.
Yeah, no.
Not going to want to leave their friends and all that.
Yeah, I think that gets harder as they get older. The social aspect of it. Yeah.
Growing up in Alaska, were you very rooted there, I imagine?
Yeah, I mean, like I said, I didn't know anything different, and all of my extended family lived elsewhere. So we were kind of alone in that sense. We didn't have any family around. So it was like the once a year trip to Florida or DC, or, we'll all meet here this summer, that kind of thing. But yeah, I felt like rooted there. I felt like my dad was really connected. My mom was a nurse, so she was really connected with like the medical community. And yeah, I feel like it was a great place to grow up.
I'm just thinking about the call your dad must have made to your mom.
Yeah.
So we're in Alaska. I'm in Alaska.
Right.
And I like it here.
Yeah. Right.
And there's a plane leaving tomorrow. You can get on it. You should come here.
Oh no, they drove up together.
They drove. So how do you do that drive?
So you go, there's a few ways to do it. You can go to Seattle and you can get on a boat, and then you can go like inside passage, put your car on this boat. But I think then what they did was go through Canada. And I don't know at what point they went up, because I've done the drive a couple of times as well. But I think it was through Montana, maybe. It was like kind of our last state before we went through, and then through Calgary, and then Yukon Territory, and then you're kind of north of Anchorage, so then you go south through Alaska.
How long does that take?
Well, I think the quickest we did was like a 3-day.
Okay.
But if you could take longer, I mean, it'd just be amazing.
Yeah.
You could spend a lot of time in those places.
Yeah, because that road trip, that's a lot of cool terrain to go through. You could stop at so many different places that would be worthwhile.
It's so cool. I've done it. I did it once with Chris after he graduated college. We went to Vegas, and then we went north from Vegas. And then when I went back to school in Arizona, I did it with my dad, and we drove down together to Arizona. Yeah.
By the time you were 18, were you just itching to get out of?
I mean, pretty much everyone leaves. It was like my peer group was like, where are you going to school, right?
Yeah.
You know, and so, yeah, definitely itching for new experiences and to get out of Alaska. Yeah.
What were you thinking? Had you spent a lot of time in the lower 48?
Yeah, I mean, I had it just through, you know, family trips annually, and then a lot of trips to Seattle. So I felt like I knew parts of the Pacific Northwest and the East Coast. Yeah, before I left.
How did you decide where you wanted to be?
You know, that's a good question. I still don't really know how I
When
decided on
in
NC
Illinois,
State.
I'm always like, how?
Right.
Especially when it's not job related. It's like, how did you come here?
Well, so first I went to engineering school in North Carolina. So they have a really good engineering program at NC State. So that was like the first decision. We also had really good family friends there. So anyway, yeah, it was a long way from home, but I had a great experience at NC State. And then from there, I went back to school in Arizona for naturopathic medicine. I did a 1-year residency in Wisconsin, and then here.
Okay.
So that's where we've gone.
So you got close to Wisconsin.
Yeah.
You were in Wisconsin, so you got close to here.
Right, exactly.
And you're probably like next biggest city near here.
Exactly.
That's usually what happens.
We were too young for Wisconsin at the time. It was a little sleepy for our stage of life.
I was born in Wisconsin.
Were you?
I was born in Janesville.
Okay.
And my uncle and my cousins are still there, and they do a lot of business there. And it's like big fish, small pond, I think.
Yeah.
Right?
Yeah.
Which I get the appeal of, but there's more cars that have passed behind us during this interview that have like passed their office in a day probably, right?
Yeah, right.
And you're just like, there's something I love about the action of a city.
Yeah, me too.
And then there's something that's too much about it. And then you see that transition as people leave the city.
Right.
And I don't know, it's so strange. As now that we're having kids, like I see the city differently. I see it differently than I ever have.
Sure.
And I'm not even there yet.
Right.
But I just think about what's going to be conducive to the life you want to design for yourself as you're having children, as you raise your children,
100%.
And what you want them to be, or what type of values you want to impart on them because of the environment that they grow up in.
Totally.
And it's strange because you're here and you're like, okay, so there's public schools, and there's private schools, and
Right.
there's Montessori schools, and there's
Right.
Waldorf schools,
Yeah.
and there's all types of options and things like that.
Yeah.
They're hard decisions.
They're hard decisions, but I think having a child forces you to put someone else's needs above your own, right?
Yeah.
So that's, I think, what changes the lens on your surroundings is like, is this going to work for someone else, right?
Yeah.
A young person. Is that what I want them to see and experience on a daily basis? Yeah.
So you started off as an engineer.
Yeah.
You went to engineering school. So what happened after that?
So I studied biomedical engineering, which included like pre-medical prerequisites. So I knew I wanted to go to medical school.
So is that like chemistry or?
Yeah, like biology.
When you have that
chemistry,
degree, what's the
physics.
typical trajectory from there?
Oh, so if I would have stayed in engineering, colleagues have done like, let's say, work for a artificial joint replacement company, right? Something like Stryker that makes implants for joints, right? So something like that, or like pharmaceutical development, or kind of like the tech side of healthcare. I think it's probably a good way to describe it.
Okay.
Yeah. But I didn't think I wanted to do that. I wanted to interact with people, and I really wanted to study healthcare. I have a lot of family members that come from healthcare backgrounds, so that was always one of my goals, is to be a provider. So through my personal interest in nutrition, I found naturopathic medicine, and so that's when I went back to 4 years of naturopathic medical school after undergrad.
When you were in undergrad, did you know you were going to do that?
Not exactly.
When did that come to you?
I feel like it was actually after undergrad. Kritz and I moved to Alaska for the summer to work on my dad's golf course, and I just started exploring nutrition on
Wait,
a
so you guys
personal
moved
basis.
there to like help your dad out?
We did.
That's cool.
We lived in the motorhome adjacent to the house.
That's really cool.
Which is a motorhome we now have in Illinois, and we take our family on trips. Yeah, so now this motorhome lives up in Gurnee, and we go get it for the weekend. But anyway, that it was like a little soul searching, right? So it was a year after college. What am I going to do? Am I going to go to a medical school? Am I going to go to nutrition school? Like, and how can I kind of figure out what I want to do? So we did some traveling too. We went to Southeast Asia, and yeah, I mean, just kind of figured out that I was really interested in nutrition. So changed the course a bit.
It's courageous to do that.
Yeah.
To stray away from what you've invested time and money into.
Yeah.
And to go in a completely different route.
Right.
I imagine, though, that background helps in what you do, or at least in what you went into in terms of studying and what you do today.
Yeah, I think, biochemistry and, problem-solving skills with an engineering background is just, I think it's really helped me with my career and my practice. Absolutely.
When someone comes to you here, what's that look like?
Yeah, so first, it's a really comprehensive intake. And so that includes about an hour spent in discussion, going through current concerns, past medical history, lifestyle factors, nutrition, medicine, supplements. People bring labs to me for me to review. So during that time, what I'm trying to do is assess the root cause of their primary presenting concern. So that's my job as a naturopathic doctor, is trying to get to the bottom of why this is happening. Are there dietary factors involved, lifestyle factors? How can we support the body in its healing processes rather than suppress, right? So a lot of conventional medical theories are more suppressive, right? We just take away the symptom with a pill rather than work to change physiology to an environment that supports healing. Yeah.
I have a few friends that are doctors or going to be doctors.
Yeah.
And when you talk to them, they're like, we're great at fixing. Like, we see your knee, like, okay, we're going to figure out how to get this knee back together. But in terms of actually analyzing people and understanding what's happening with them, it seems like the medical field isn't very advanced in that.
Yeah, I was thinking about, that too. Just thinking about how it's more work for someone to sign up for care with me, right? Because I'm going to tell you to change your diet and take supplements and sleep and
they have to want the process.
That's hard, right? It's
like
easier
losing weight in a way.
To pop a pill,
right?
And so I think that the two absolutely need to exist, but can coexist. And when someone decides that they want to take that action for themselves and really play a more active role in their health, I think it takes that type of light bulb moment for someone when they're like, I just don't want to be a passive, person in my own healthcare regimen, right? Just that more active role, I think, is what a lot of people seek nowadays, and that's who I see typically.
When someone's seeking you out, what's going through their head? Like when someone walks in your doors, or when they call you, what's that like? What makes someone want to come here?
Yeah, I think that there's either people that seek natural options first. So if I told you had high cholesterol and you had to go on a statin medicine, you might say, oh, I don't want to do that. What else is there, right? So they start, researching what else is there. So that's one type of person. There's the person that's maybe failed conventional therapy. So you've already tried this medicine and it didn't work for you. So there's more to the picture and you want to work on that. Or people that are generally well and they just want to fine tune. So I think the other thing about what I do is kind of work in this gray area, because I think conventional medicine is really good when there's a clear diagnosis, right? But when someone doesn't always fall into that clear cut, checking all the boxes, but there's still all these symptoms and there's not a medication for that, people are left scratching their head. Well, I don't feel well, but everything's okay, so they look for then, other options.
So I've had back pain forever, and I just saw a doctor and got my x-ray, looked at it, said everything's fine. And I took it to another doctor. He walks in the door and because I still have pain, so clearly there's something, right? So I bring it to another doctor. He walks in the door, he's like, so your lower disc is thinning. I was like, what? He was like, oh, the last doctor didn't tell you that? I was like, no. He's like, oh, okay. And there's this moment where the doctor recognizes that one of his peers didn't do what he should have. And now how does he move forward? And it was almost like a regaining of trust at that moment. But then all of a sudden I'm like, okay, I like you now.
Yeah,
you're telling me something.
You're like, oh, there's something wrong.
Yes, we're working on the problem.
Right. Yeah.
And then from there, I had to submit for an MRI. The MRI got denied by insurance, so they had to do a peer-to-peer. That I got the call today that it was approved.
Oh, good.
But now we're a month later.
Right.
Right? And it's crazy how long all these things take.
It is. Yeah.
And so now I have to go get the MRI, and I'm looking at the research on it, and it's like if I do want something, then it looks like it's the cartilage, right? That's in the disc. So I'm like looking at stem cells and all these different ideas.
Right.
It's very interesting, but now I'm going through this journey of where do I go next?
Where do you go next? Right. What are your options?
Yeah. So when someone's come to you, they've seen the doctor already maybe, and they don't like the path, or they want to try something different that worked for them.
Exactly.
And I would imagine that it could be hard for someone to find you because you are in that gray area, like you said.
Can be.
Yeah. So how does someone do that? How do they know to come here?
I think, thanks to the internet, people are very informed about their health conditions, right? So when they're looking for alternatives, I think there's so many people in this space that are using herbs, that are using nutrition. And so I think that one thing people might come across is, maybe a nutritionist or an influencer or a supplement line, and that might lead them down the path. Well, who can help me with this, right? Who is the, practitioner expert in this space? So naturopathic doctors are the only 4-year graduates of nutritional medicine programs.
What are the others?
So, I guess if you're comparing other, modalities, let's say acupuncture, right? So that's Chinese medicine. If we're just thinking about nutrition, right? So if you just had a nutritionist degree, you don't learn all the physiology and diagnoses and things like that. So our training is more like a primary care doctor that specializes in natural and nutritional medicine. So I think that kind of sets me apart maybe than some other fields of conventional or alternative therapies.
And anytime you hear alternative, it's like whether it's alternative history or alternative medicine, people are like, where are you going with this?
Yeah, I don't actually think that's the best term. I probably shouldn't have used it because I feel like what is an alternative to? It's like it's just a different approach. It doesn't mean it's shouldn't be a part of the team. So what
is, when someone asks what you do, how do you describe it? Like, what's your elevator pitch?
So my elevator pitch is I practice herbal and nutritional medicine with an emphasis on women's health. Okay,
so the emphasis on women's health.
Yeah.
Would you ever say Eastern medicine? Would that be accurate?
I don't think it would.
Right?
Yeah. Yeah.
It's interesting. So Yuna's grandfather was a brain surgeon. He was a lawyer. Thought law was too easy, wasn't challenging enough for him, so he became a brain surgeon. And his approach was Eastern plus Western medicine. And so very Western studies, Western diagnosing, but taking an Eastern approach of how to fix it.
Gotcha.
I think he was very successful, and he patented a number of things and supplements and things that he sells. He's passed away now. When he passed away, there was a procession of cars so long it looked like a president died or someone of stature. It was unbelievable. Her mom took this picture with all her sisters and everything, and you could just see this huge line of cars. Like, wow, I wish I could have met this guy.
What
he was a huge man too. He was like 6'6" and over 300 pounds. And that's Samoan blood. Very big. But that's always interested me is the Eastern approach to Western medicine. And I feel like that's in the category of what you're doing, but not. But just this, when you're going through alternative or talking about different ideas.
Right. I like integrative better.
Yeah.
Because, I really believe in both.
Yes.
Both sides of the coin. They can work together. They can work alone. So I like to think of integrative, and that puts everybody on a team too, right? Because I don't like to think of, myself as being a sole team member. Like in anybody's healthcare, you need multiple different providers.
Yeah.
So,
and just have a different opinion.
Yeah, exactly.
You know, different perspective
Another
on this problem.
perspective on the same problem, like you had with your back.
Yeah.
You know, same with my naturopathic colleagues. You probably get 6 different treatment sheets, you know, for the same problem, but it's all the same goal, you know, is to support the body's natural healing ability.
Focusing on women's health seems like a natural way to do it. You're a woman.
Yeah.
You have children.
Right.
You dealt with a lot of, you're dealing with it.
Yep.
It would make someone, I think, very comfortable speaking with you for one, but also gives you an innate approach and feeling about it that someone else may not have. So when a woman comes to you, what are some of the things that they typically are experiencing and want to discuss?
Yeah, so issues related to the menstrual cycle, maybe that's PMS or heavy periods or irregular cycles. And then on the other end of the spectrum, like entering perimenopause or postmenopause. Fertility is another big area that I work with women on. And then part of my approach too is always gut health. So there's always this like gut health category that I see people for, whether that's, you know, a chronic or acute symptom related to their digestion. So that's where the nutrition piece really comes into my practice a lot. And yeah, I think that really gut health is the core of your health as a whole. So we always work on that no matter what someone's coming in for.
And that seems to be something that's really grown in what, the last 10 years maybe?
Yeah, I feel like that's true. Yeah, definitely. I get a lot more people, you know, asking me about something like a stool test, you know, looking at your microbiome, right?
Well, I told you about the biome thing that we took.
Yeah, exactly. Yeah. Direct-to-consumer testing is really popular, which also I think raises that level of interest for people in seeking integrative approaches, right? Because there's so much available to you as a consumer now. And then, you know, what do you do with that information, right? So, yeah.
You're hearing more too about like boutique healthcare? Or what are the extensions of that?
Are you thinking like concierge?
Yes,
care?
concierge healthcare,
Yeah.
Would you consider this in that envelope?
I mean, I think it's very boutique in that I have a small practice, really personalized care. You know, to begin work together, we do a series of 4 visits. So I really get to know somebody. But concierge, I guess it depends on the provider. Typically in the concierge setting, there's a primary care provider, and then they're essentially kind of on call for both, you know, annual needs and then acute needs throughout the year. And you usually pay like a set price just for all those things throughout a year. And usually a primary care provider fills that role. I don't consider myself a primary care provider, more of like a specialist. So small, but probably not concierge is how I would describe my practice.
So someone comes to you with an issue. What is that process? What does that consultation look like?
Yeah, so starting with the initial visit that I described, and then from there, we follow up over a series of at least 3 follow-ups to get started. Usually those are spaced about a month apart. And at each of those, we're evaluating progress, looking at new labs, making tweaks to the plan that might involve nutrition changes, herbal medicines, nutritional supplements. And by the end of the 4-visit series, we expect to have a good plan going, and then just think like, well, when do we need to follow up next? Is that in 6 months after we recheck this lab, or is it in 12 months because you're doing really great and you can just reach out to me as needed? Yeah, so I'm always available for my patients after the initial 4-visit series.
And what does that usually look like? So they do the 4 visits. And you're recommending a new regimen. So what do those recommendations look like? And I know that's very broad, but just
no, I think that's a good question.
Maybe someone comes in here and like, when someone comes to you, what do they say? Like, if let's say it's not menstrual related, let's say it's gut health related.
Yeah, sure.
Or you tell me some of your customer clients.
Yeah,
patients,
right. So I guess if it's gut health related, let's just take a case of like bloating. I see that a lot.
Okay.
So through our intake, of course, we'll talk about nutrition. We'll talk about past medical history, you know, that could lead to the current concern. You know, if there's a history of food poisoning, or if there's a history of frequent antibiotic use, you know, they had strep all the time when they were a kid, right? How has that disturbed their microbiome? You know, that's how I'm kind of thinking throughout the visit. Are there any disturbances to the microbiome that we would need to rule in or out through something like a stool test? And then through the nutrition discussion, we might think about, well, are you eating something that's triggering this bloating? You know, so there's things like elimination diets or specific food groups that we might choose to pull out of someone's diet, at least for a time, to see how it affects their digestive system. There's also food testing. So when we put both of those items together, you know, we can come up with a comprehensive plan. So then when someone leaves an initial visit, they'll have lab recommendations, they'll have nutrition recommendations.
Okay.
And then at the same time, I'm thinking about, well, if we think it's the microbiome, maybe we start with some probiotics, or maybe we start with some enzymes to help aid food breakdown. You know, there might be something therapeutic that we try before we get data back, just to see if it helps in the healing process. And then once we get labs back, then we do that next fine-tuning step to say, oh, well, we did discover that there's this bacteria that, you know, could be causing some of the bloating that you're experiencing. So now we'll do herbal antibiotics as a part of your plan. You know, so we're always kind of fine-tuning depending on the labs and the patient's response to recommendations.
What are herbal antibiotics?
So they function to rebalance your gut microbiome. So one example is an herb called berberine, and I use that in a lot of cases of SIBO or general dysbiosis.
What's SIBO? You gotta talk to me like
So now I'm on another topic. So that stands for small intestinal bacterial overgrowth.
Okay.
So it causes a lot of bloating for people, which is why it came to mind.
What is bloating? I mean,
yeah, it's like trapped gas.
Okay.
It's like it's not going anywhere gas, right?
Okay.
It's not going up, it's not going down, it's just trapped. And women will always tell me that, oh, I look like I'm pregnant. Like that's what I hear a lot from women. And you know, that can be because of irritable bowel. So someone might also have then diarrhea, constipation, or both alongside this bloating. SIBO is just another diagnosis that's abnormal bacteria in your small intestine. So, yeah.
you mentioned fertility.
Yeah. Mm-hmm.
So when we wanted to have a baby,
yeah,
we didn't think we'd have a baby so quickly.
Okay.
Because everyone we know has fertility issues.
Gotcha.
It's so common.
Yeah.
It's funny, all of our Asian friends, no problems. Very interestingly enough, I don't know why that is, but like all of our white friends, years to have children.
Okay.
Right? Like everyone, it was this journey that they went through.
Yeah.
Some intervention, some not, but just took a lot of time.
Yeah.
So I imagine it's a very popular topic and something that people see you for.
Yeah.
What is that? If when should someone come to talk to you?
Well, technically that depends on the women's age.
Okay.
So if you're less than 35, you should try for at least a year. I don't know. I mean, I think if there's any sort of known issues, of course, that would be sooner. So if someone knew they had a condition like polycystic ovarian syndrome, PCOS, they would certainly seek healthcare before that. But after 35, it should be within 6 months of trying.
Okay.
Yeah. But I typically see women sooner, no matter their age, because they're taking that proactive approach.
That's what I would imagine.
Yeah.
I imagine like, we're gonna have kids. Let's go talk to Kelly.
Yeah, right. So I saw someone this week that was like, well, I think I might have kids in the next 3 years. What would you recommend? And I'm like, well, that's a long time frame, but I'm glad you're planning ahead, you know? And then the official, like, you know, what next step someone takes just depends on, you know, what they've tried already and what their past medical history looks like. So even if someone is going to do, you know, any sort of reproductive assistance, you still have to build that foundation for good health. And I feel like that's where this comes in, no matter what. If it's IVF, if it's natural, it's like foundation has to be there, foundation of good health, which starts with nutrition. So.
What type of providers do you work hand in hand with? Like you just mentioned IVF, so if someone's been working with you for how long before they go to that route?
I think it depends on the timeline. I mean, I see a lot of women that, you know, are already doing IVF treatments and they come to me, or, you know, have been trying for 3 years and they just really don't want IVF. So it's very patient dependent, but I'm happy to work alongside any other provider. Yeah, as part of that team-based approach. Yeah.
What other reasons do people come to see you?
Yeah, I think, you know, just general wellness, just wanting to know how they can better their lives through nutrition and lifestyle changes.
So when you get that nutrition, someone comes to see you,
Yeah.
I imagine they go somewhere else, they do a stool sample, blood work. Is that right? They have to go to a different facility to get that done?
No.
You can do it right here? Oh, that's cool. So it's all in-house, one place.
Yeah.
So when you take that, you send it to a lab, I imagine. Those labs come and pick it up?
It's in the mail. You do it at home.
Yeah.
Yep.
Okay.
Yep.
Oh, so the person does it at home?
Right.
Okay, got it.
Yeah.
And so then you get the results. How do you determine what that person needs or what they don't need, which I think is often just as important?
Yeah, right. Well, I think some aspect of that now is experience, since I've been practicing for 10 years in Chicago now. And
I didn't realize. I thought it was sooner, or I thought it was less time.
No, so I moved here in November of 2011, so over 10 years. So that's one thing, is like I've seen it enough times to kind of recognize patterns. And so then we just kind of pick the results apart and say, you know, what food could we use for this abnormality, or do we need a supplement here, do we need an herb, you know? So I think it's just dependent on the person's, you know, presenting concerns. And I think that's the other thing, is to try and match what they told you. So you have to be a really good listener and a really good historian in that initial intake. And then the results come back and you try and match the two up. Because some things, you know, on a test result might not matter, right? That's, you know, just them, or it's something that really has no impact on their case.
It seems so nuanced.
Yeah, I think it is. And I think that patients always tell me they really appreciate having someone listen to them, because that's one advantage that I have is spending so much time with people that I really get to hear the whole story, and we're not just sitting together for 10 minutes, you know, in a really quick visit.
That's one of my biggest pet peeves about doctors, period.
Right.
It's just like, I'm clearly on this time cycle.
Right.
There's no question, there's like just the questions they want, or like to whatever reason you're there.
Right.
But never like, hey, I'm trying to get to know you.
Yeah.
And then as soon as you get to know a doctor, it seems like they're gone.
Yeah. Yeah.
It's the worst.
Yeah.
As opposed to being a kid where I saw the same doctor for 15 years.
Yeah, right.
I feel like those days are gone.
Yeah, maybe to some extent. Yeah, especially I think with specialist care. They're just, I think primary care maybe could fill that role as an adult, but I feel like a lot of my patients don't have primary care, right? They're just kind of seeing specialists as needed for various health concerns.
You mentioned nutrition.
Yeah.
And as I get older, I feel like more sensitivities, either I'm aware of them more, or they're developing as I get older.
Yeah.
What do you have to say about that?
Yeah, I think that your tolerance to food can change with time. And I've seen that with patients where they're like, well, I know I don't have an allergy, or I mean, I know I'm fine with this food. It's like, well, that can change, because you're not the same person you were, you know. So it's important to think about your gut in terms of if that is a changing system, as well as your overall health. So your tolerance to different foods can change with time. How your liver detoxifies changes with time, and depending on environmental exposures. You know, one thing I talk to patients about is kind of thinking of your body and your tolerance as kind of like this bucket, right? It's like there's the environment, and then there's these foods you've always been eating, and then there's, you know, external stressors, right? There's only so much that this bucket can hold, and then you might express a symptom.
And that's the overfilling of the bucket.
That's the overfilling of the bucket. And then we're trying to figure out, like, well, what tipped that scale, right? Do we need to back off on certain food groups? Are you being exposed on a daily basis to something in your environment? Do you have mold in your apartment? You know, all these different things. Like, what is tipping that bucket so that now you're expressing a symptom, and all of a sudden you're sensitive to this food where you weren't before? It's kind of like, start to drain the bucket, right? Let's calm things down internally, figure out what's filling that up.
I was just talking to someone whose family, they're bakers, and someone in the family was talking about heirloom wheat, and like the wheat we have today is different.
Yeah.
And that's why you see these differences. Do you know anything about that?
I do. So as part of my residency program, I was with this amazing cardiologist in Wisconsin, Dr. Davis. He has a whole book about this, but essentially the short story is, in America, we've grown our wheat to be a really short plant, so it grows really quickly, and it doesn't, you know, grow to its full height.
So they can replenish it, have more cycles.
Exactly, so more cycles, right? So this is actually a man-made wheat plant versus the heirloom, which is long, and it takes, I don't even know how long it takes to grow
Yeah.
something that's
Probably
not quick.
Probably one season.
Yeah, one growing season, right? There's not a lot of turnover, right? And so essentially it's like genetically modified wheat that's made its way into our food chain. So I think there can be differences in how people metabolize those sorts of foods.
Yeah.
Yeah.
I was talking, one of my friend's dads is a doctor, and we were out to dinner, and he was talking about how great GMO plants are, because like in other places of the world, it's helping fight starvation and other items because they can do it. But then your places like here where you're like, tell me more about GMO. Like, I know what I know, which is very baseline. I think it's very top of mind for some people, and some people don't care about it at all.
Yeah.
It's a talking topic that I really don't know anything about.
Yeah, I wouldn't say I'm an expert either, but I just always think about it in terms of, is it naturally occurring, right? Is your body going to recognize something as foreign because it really shouldn't be there, right? And then does that set off your immune system in the case of autoimmune disease, or does that set off your gut and all of a sudden you have symptoms, right? So I always think about, you know, trying to be as natural as possible, right, with whatever you're putting into your body. And if it doesn't exist in nature, is that really going to assimilate with your body as well as it could?
Well, it seemed like from the 50s, where you know, like TV dinners and putting chemicals in everything to preserve it.
Right.
We had this huge spike in that. Probably got big in the 70s, 80s, 90s, and then we went to all this natural stuff from there.
Yeah.
And people are trying to get back in tune with that. But it also seems like we went too far down one road where it's going to be very hard to bring it back.
Yeah, I think so. Yeah. I think there's probably a happy middle ground, you know, like choosing some pre-made items that feel good for you, and then, you know, eating whole and processed foods as much as you can. Yeah.
Do you have any general advice for people? Just things they can do every day that anyone can take regardless of having a consultation?
I mean, I feel like as it relates to nutrition, people can always do better with vegetable intake.
Vegetable intake?
Yeah. I mean, that's probably a really simple thing to say, but like, just when you're building every plate or every bowl or whatever it is, just to make sure that the majority of that is a vegetable. So something green or something, you know, colorful on your plate. And then I think a lot of people also kind of underestimate the importance of protein and getting that with every meal too. So I'm a big proponent of protein and produce with every meal. I feel like I say that a lot in practice.
I say plants and animals.
Yeah, I think that's the same thing.
Like when you would ask me what I want to eat, I'm like, plants and animals.
Yeah, exactly.
You know, it's crazy. I used to love pasta and love pizza and everything. And then you notice how you feel after you eat it. I'm like, I don't feel that hot. I feel okay, but I don't feel great. Yeah. But if I just have plants and animals, I'm like, okay, what do you want to do? We can do anything we want now.
Exactly.
But if I have a pasta dinner, I'm like, it's like bedtime soon.
Totally. And I practice what I preach. And I don't have any cravings for anything, right? And I feel like when you eat in a way that really nourishes your body with plants and animals, and you don't crave sugar and you don't crave carbs, and you're in tune with how your body feels when you go out to one of those heavier meals and you're like, I just can't do this, right? I think your body really adjusts a lot when you're focused on whole, unprocessed foods. Yeah.
Now, I've thought of that. I wonder, when you go so far down that road, then you have something like milk or pasta or gluten, whatever it is, and you have this flare up. Right. Is it because you're not having it? Like, would it benefit to have it sometimes to work it in? Like, do you think there's...
It can be. I mean, I think that I always ask patients, is it a worth it flare up, right? Because you know it's going to happen, and it might be worth it. But then, like, if you do choose to implement a food more regularly, is that going to be irritating, right? So I really think that it's up to the patient to decide, you know, and experiment with their nutrition. If it's just the once in a month thing that they do that really sends them into this couple day flare, or is it something that, I want to have it, so I'm going to live with this little daily pain, right? And I know what it's from. I think that knowing the answer, where it's from, is really empowering for people. So once you know that, you get to choose. Yeah.
How about kids? Like, what kids should be eating?
Oh, that's a good question, because I think that going into parenthood, you might have ideas of what you want to feed your kids, but that's harder to do in practice. So at our house, our kids eat what we eat for dinner, and that's just kind of a rule, you know. And if they want something else, you know, the options are limited. It's like, you know, they can have full-fat Greek yogurt, or they could have a banana, or they could have, you know, some crackers, right? You know, there's this short list of alternatives to dinner. But for the most part, I think it's the same principles. It's like, get something green on their plate, right? Healthy fats, proteins, and they need a lot of protein to grow. So I think that's really important. Yeah.
Healthy fats is a concept that I don't think I knew about 10 years ago. And now it seems very top of mind.
Yeah.
In other countries, when they have fat, they call it, you know, energy.
Yeah.
Which is always interesting. Like we came up with the word fat here, but sugar is still sugar.
Right.
And what is a healthy fat? Why are fats healthy? Why do we need fat?
Yeah. I talk a lot about hormones in my practice. They are the building blocks for hormones.
Really?
Yeah. So the
male or female,
biochemically, right? Cholesterol is the starting molecule, and then we make adrenal hormones, we make reproductive hormones, all from cholesterol. So we need fat. And then healthy fats are those that are just naturally occurring, right? The unhealthy, maybe it's easier to talk about in terms of what's unhealthy, are those man-made fats, like trans fats, or, you know, oils that don't exist in nature, right? They don't exist in nature, so those are the bad fats. And then the healthy fats are naturally occurring in, you know, an avocado, or nuts, or seeds, or meats, or fish, right? Those are all the healthy fats, the naturally occurring ones.
I want to segue into natural birth.
Yeah.
So you've had a natural birth twice,
I have.
Right? Let's talk about that.
Yeah. Well, as a naturopathic doctor, you know, that was part of my schooling, was to attend a natural birth. So I think that was my first introduction, as I was paired with a pregnant woman in school, and I went to all of her prenatal appointments, and then I went to her birth in her home. And to me, that was just an eye-opening experience to, like, you know, most women don't even think there's a different choice to make other than a hospital. And so to see it in action really planted that seed for me when I was making the choice, what I wanted to do and what I felt comfortable with. And so with my son, we knew we wanted to have a home birth in Chicago. And so there's a few providers that we interviewed, and then, you know, proceeded to have all of my appointments with a home birth midwife, all of my prenatal care. And then my birth was a wonderful experience at home in Lincoln Park. And, you know, I think the beauty of that experience was feeling really comfortable in my environment, and still feeling really safe with a midwife and all of her training and equipment brought into my home. And being in this urban area, you know, a hospital is very close by for, you know, a worst case scenario. But baby is very important in this whole scenario, and the health of the baby. But also I think sometimes the health and the needs of the mother are not always met in a hospital setting. So.
You and I, so we met at a party of a mutual friend.
Yeah.
And I don't know how quickly we got into that topic, but I felt like we got into it very quickly.
Yeah, surprisingly, for someone we just met.
Yes. And
don't share this with many people, in fact.
Yeah. I imagine. And it's something I always lean towards.
Yeah.
And I think luckily, you know, it's probably why you and I are married, but like she sees it the same way. She found out both of her parents were born at home.
Really?
And then after researching it more, I learned how much more this occurs in other countries.
Yeah, right.
And how prevalent it is, and how it's incorporated more into the healthcare system too in other countries.
Right.
And here it's no one has any idea it's an option, or doesn't think about it, or doesn't see. To me, you just look at the benefits of it.
Right.
And I understand if you come from a fear-based mindset, it's going to be scary to anyone. If you think of like what are the worst case scenarios that could happen.
Right.
I was just talking to a friend about it, and I think Una mentioned this to you. Mentioned this to Una about like don't mentioning it to people, because you're going to get a lot of unsolicited feedback, right? And I was like, that's pretty smart. Because I was telling her one of the reactions of one of our friends, but then I was talking to someone else, and he was like, yeah, so, you know, the natural position you're in when you're giving birth, like that they do in a hospital, isn't that like the worst position? Right. Yeah. Can we talk about that? I had no idea. He brought this up. He's like, yeah, like you should be squatting or on all four. So you go ahead.
It depends on the hospital, but there are some restrictions made to movement. And to some extent, that's because of equipment that you're hooked up to, whether it's starting an IV or it's continuous fetal monitoring. So there's restrictions in the hospital environment that don't allow you always to get into certain positions that would be more comfortable for birthing. Yeah.
And like, why is that? I mean, you mentioned why it is, but it would seem if we do have these better positions, we should be in these positions. And then you see a natural birth, it looks nothing like a hospital birth. So what are some of the, as someone who's gone through it, but also as a professional, why did it speak to you? And why would you recommend it to someone?
I mean, I think it just really spoke to me, the ability to choose what interventions I wanted. And I think sometimes in a hospital setting, that's a choice that is made for you or out of that fear-based mentality. And when you're going into your birth with a empowered mindset, knowing that you have the people to support you around you and you can communicate with your provider about the decisions you want to make, I think that's a more empowering scenario. So that's what I wanted to feel with my birth.
And you have nothing to compare it to, but do you feel that it was easier or more conducive, or did you? I mean, empower is a very good word. Thinking about that, you feel like you're owning what you're doing. You're making the decisions.
Owning what you're doing. I felt like my births were incredible. I mean, they were painful and they were all of the things that people might choose the hospital setting for, but I just came out of both feeling great. I mean, it was a wonderful experience. So then, point of reference, and my sister recently had a baby, and she had a lot of interventions, but her birth story is also told as, this was wonderful. It was perfect for her. She wanted a lot of pain relief, and she tells the story, well, I was just watching TV for 4 hours and then they told me to push, right? But she loved it. That was perfect for her.
It came on my radar when I found out how many people have C-sections. And it seems there can be an argument to be made that there's a business side to that for the hospital. And then I learned more about that, and you're like, oh, interesting. And that's how I I learned about the whole home birth, natural birth idea. It just seems like a way more natural thing. We've been doing this for so long, too. I mean, thousands of years we've been giving birth outside of this setting. And yes, we used to have a lot of different things. Do you know how Listerine came about, by the way?
Listerine?
Yeah.
Oh, I don't, no.
So there was a hospital, and there was a hospital that had a, where do they keep the dead bodies?
Morgue?
In a morgue. And they had a morgue in the hospital. And they had a nunnery next door. The nunnery would take the overflow of the birthing at the hospital couldn't take, right? So at the hospital, they had twice as many deaths as the nunnery. And what they found was, this was like predates germs, is the doctors were going from the morgue and going to deliver a baby and bringing all of the germs with them. And the doctor who originally, and this is my understanding, I'm sure I'm butchering it, but he was mocked. And I think he was just recently indemnified over it, but he's basically lost his entire career with the idea that these little things are on us that we can't see, that are microscopic. But he created a Listerine solution to put your hands in.
Oh, got it.
And so his doctor's like Dr. Lister or something like that came up with it. But I always thought it was such an amazing story, because there's so many people that are ridiculed in their careers until they're not. And maybe they're indemnified afterwards and they're brought back up. For a woman that's seeking that, what does that process look like? How do they approach it different in birth? For the birth?
I think first of all, you have to feel really comfortable with your provider. So don't hesitate to go on lots of different prenatal visits and see, you know, who's a good fit.
And that's your midwife?
Yeah, so it would
what's,
be a midwife.
Technically, what's a midwife, and like, was there training for the midwife? What is...
Yeah.
Midwife isn't like a... I think, I don't... When I have the vision of midwife, it's not what it really is what I think. So can you talk about the qualifications?
So there's different training. So I'm not an expert on all the different training programs, but I know there's certified nurse midwives. So you would go to nursing or maybe nurse practitioner school. So you'd be certified in that way. Or there's a lay midwife. So that's for someone who doesn't go to nursing school. They just decide, I'm going to go learn how to deliver babies, right? And that's what they focus on. So that is 2 different designations as far as I know. And then each state licenses either differently. So midwives, certified nurse midwives, do work in a lot of hospital type settings alongside conventional type practices.
Okay.
And then the lay midwives are typically those that are like just doing home births because they aren't licensed to work in the more conventional setting. So I think that, you know, I don't think the skill set necessarily differs. It's just that background that someone might have, you know, to get them into midwifery. Yeah.
Midwifery,
yeah. And midwives can serve as women specialists as well. So a lot of people just think, oh, I have to go to my gynecologist for my annual exam, but you can choose to go to a midwife. So even for annual care, if you're not, you know, planning to have a family or aren't pregnant, you can go for annual pap smears or any, you know, women's health related concern. Midwives.
You're sending it to a lab anyway.
Yeah.
That makes sense. Because you might feel more comfortable with that person.
Right. And they do take a more, I would say, more natural spin. You know, they're not the specialists in intervention, right? That's your obstetrician, gynecologist,
if there's
surgeon.
an issue, then you're going to go see that person.
Then you're going to see that person, right? So I also think of them for natural women's annual and routine healthcare. So not just pregnancy and birth.
I never thought about that. That makes perfect sense.
Yeah.
How does healthcare work into all of this?
How does what?
How does health insurance?
Oh, health insurance?
Yeah.
That's a good question. I mean, for us, we paid out of pocket, which was probably less than our deductible. You know,
it absolutely is. I've looked into it for us, and it's like, we're going to be paying a lot more. I don't care.
Right.
Like, I'm willing to do that. But
yeah, but it's also kind of surprising that our insurance didn't cover it, because in fact it's less expensive for them to have me birth at home.
Yes.
And
I thought the same thing. Like, and I looked into it in other countries, and like every country covers it.
Yeah.
It's amazing. So if someone's coming to see you, how does that work with insurance?
I don't accept insurance.
Okay.
It's fee for service.
Okay.
Yeah.
Do you find that as an impediment in your practice?
Yeah. I mean, it limits accessibility.
Yeah.
That's for sure. But for me, I don't think I fit into the insurance model, because the insurance model is to see 30 patients a day for 10 minutes each. And I don't do that.
Yeah.
I see maximum
It sounds
of like...
terrible.
It does sound kind of terrible. I see like 6 or 8 patients a day, from, you know, 30-minute follow-ups to hour to 90-minute initial visits. So there's no way the insurance model could reimburse me for that time for each person.
And I imagine it's, if as long as your practice is successful, it's a better thing for you, because it's unfortunate that maybe there's someone who could benefit from your care that doesn't have access to it. That's the downside.
Yeah.
But the upside is that the person that's coming to you knows what they're getting,
Right.
is here because they want to be here, they're comfortable, and they want what you're offering,
Right.
not just going to the person that fits within their healthcare plan.
Yeah, yeah. I think that, people feel really empowered by coming here. Like, they're taking control of their own health.
Yeah.
And that's what's really important to them, and to play an active role. And it's a better relationship for us both, because they get the results because we work so closely. And then for me, getting to see that is why I keep doing what I do.
Do you have any really cool stories of people you've helped get past something or figure something out, or?
Oh gosh, I mean, so many. You know, I feel like, you know, thinking about yesterday, one of the patients I had is a very complex patient, and she has and still sees multiple specialists, including me. And one of the things that she really needed help with was her gut function. So she was highly reactive to a lot of different foods and environmental toxins. And this was causing a lot of digestive symptoms. So she had a lot of diarrhea, but also like her energy was then impacted, her sleep quality, because she was waking up at night to go to the bathroom, you know, so it just creates this ripple effect when her digestive system was affected. And, you know, I kind of went into her initial visit thinking, how am I going to help her? She's really complex and she has a really long list of supplements that she's already taking. Like, how do I fit into the picture? And then, you know, from my point of view, it all boils down to the gut.
Yeah.
So that's where we started. We did a microbiome test. We did a micronutrient test to look at what vitamins she wasn't absorbing. We looked at small intestinal bacterial overgrowth. And then that's where we found some of those answers. And so on our visit yesterday, she was like, well, I don't have diarrhea anymore, and that's life-changing, right? So it's like sometimes it can be hard to really see where you're going to fit in with a complex patient, but you're always getting to that one change that you want to see, that I want to see, and that she wanted to see. And so I think that was just a recent example of like a powerful case for me, because I really went into it not clear on how I was going to help. And she did a lot of things outside of this conventional medicine system. So anyway.
Was there any one bullet that solved her issue?
Yeah, I mean, it was multifactorial, and I think that one of the things we did was just reformat her microbiome through like herbs that help rebalance bad flora, probiotics, digestive enzymes, healing her gut through foods and herbal support. So it was a combination.
What's bad flora?
So like bad bacteria, or
Okay.
parasites, or yeast overgrowth.
Okay.
Yeah. Mm-hmm.
If someone wants to come and see you,
Yeah.
what should they do? What should they be keeping in mind? How does that process start?
Yeah. So there's a lot of information on my website. So most people start to learn about my practice by going there, and they can learn about all the different health conditions that I specialize in and read more about me. And then from there, they would schedule an appointment, and they can do that themselves online or call my office. Yeah.
This was a lot of fun today.
Yeah.
If someone wants to get in touch with you, what's your phone number?
It's 773-492-8010.
And what's your website?
𝗕𝗢𝗢𝗞𝗦.com.
And what's ND?
Naturopathic doctor.
Naturopathic doctor.
Yes.
Thanks so much for this. It was a lot of fun.
Thanks, John.
Yeah, absolutely.